Let's talk about the coronavirus and immunity. Can people be immune to this thing?
Like all other viruses, the body usually mounts an immune response to anything foreign. And because it is new, then a lot of people do not have antibodies against this particular virus. So everybody is trying to make new antibodies. And that takes time. By the time you get what is called a secondary immune response, that takes like 21 days to come up with. So in the first few days where you are starting to get those fever, cough and all, the body is mounting an immune reaction against the body. So with time, we will see whether some people will become immune to this virus. But what happens is that the body makes antibodies, which are things that go to fight against this particular disease, so that next time you get that coronavirus, it fights it early. You see, now it's like the body has been caught off guard. So they are building a small army so that next time the army is ready to be deployed faster than before the virus has caused a lot of damage.
So I'd like us to talk about when a person is most infectious, because, with the common flu and the cold, tumezoea that if it's when your symptoms begin to express themselves, that's when you're able to spread and sambaza. What's the difference there with the coronavirus? Is it the same? Does it behave the same? Or can a person who's not coughing, not sneezing, not anything, still be able to pass it on?
Yeah. So when the coronavirus infects the nose or the mouth, and then it starts multiplying, they start becoming many, many, many viruses, and they reach a stage where they are now many enough such that they can now spread. And what has been shown with coronavirus, they say that you are infectious at least 2 days before you start showing symptoms.
Oh, dear
you see, this is the difficulty of it, meaning that if I'm having corona and I'm walking around 2 days before starting showing, the fever, cough, then I can spread it. And this actually is the most dangerous part of it, because when people start coughing, then you're suspecting this one might be having. But when they are fine, then they can spread it. And that's the essence of the separation, because now these 2 days before symptoms is now graduated to say that when you get infection, you may get symptoms 2 to 7 days after infection. So you see, you don't know who is the 2-day one, you don't know who is the 7-day one, you don't know who is the 11-day one. The key message here is that infection can actually be spread by someone who is not showing any symptoms. And that's why we need to separate them, filtering using that history of travel or contact with someone with COVID-19.
Can you be reinfected even after you've healed?
Yes, studies have shown that some people who got healed, meaning that the diagnosis of healing is that they had a positive, and then after being confined for some time, it was negative, then they became positive again in some of the places that we are having a high number of people with COVID. Therefore, yes, it is possible to get a reinfection.
One expression that we keep hearing is flatten the curve. Flatten the curve. And I think in our end of the world and where we're living in, we haven't got to that point yet. And we'd just like to understand what that means. Could you please walk us through it, tafadhali?
Yeah, so flattening the curve is actually described as a graph. A graph which on the y-axis, the vertical axis, the y-axis is where you have the number of infected people, let's say, and the x-axis is time. And now on the y-axis, the more people who are infected, and on the x-axis, the shorter time they are infected, then there is a place in between the curve on the y-axis, which is called the health capacity. If I may use an example I've used before, if a hospital in your area can treat 20 people at a time, and on day 1, you have 10 people, they are treated, and on day 2, you have 15, the health system can still be able to cover, and on day 3, you discharge 5, and get 5 more, then you're still able to cope because you have not reached your capacity of 20 at a time. But during an epidemic or a pandemic for that matter, you don't want, your health system can get overwhelmed. For instance, this small hospital of ours, which can only take 20 people at a time, if you have a pandemic and then 30 people come, then you have a problem. Flattening the curve means that you ensure that the number of people coming to the hospital are less than the health capacity.
Right.
Therefore, you say that even if we get, for instance, COVID-19, and you're saying today we get 10 in that 20 bed hospital, we get 10, and then the 10 are treated and they go home, and then maybe later we get 10 more. You get.
Yeah.
Therefore, the health system is not overwhelmed. Huh? Yeah. So that's the problem.
It presents a challenge. First, the medics are all overwhelmed. Their hands are tied.
Yes.
And also finding bed space, because again, it's way beyond capacity.
Yeah.
Okay. All right. Thank you, Dr. for helping us understand flattening the curve. 2 more questions before I release you. I know you've got to do a lot of inspection across the country. I think last week you were in Muranga checking to make sure, kazi yenu si kazi rahisi. But for all of us, now we have to stay home, and it's already flu season. Mvua ndio here, the whole weekend has been about rain. And so we understand that around this time when the weather changes the way it is changing, there's bound to be homa, there's bound to be flus. What can we do to take care of ourselves at home, and what should we stock in our medicine kits?
Yes. The usual healthy living continues. It does not stop in a coronavirus pandemic. So good nutrition, and as we have always said, good nutrition is a balanced diet of carbohydrates, proteins, vitamins, and fats in the various ratios, good ratios. So whatever is available that can supply these nutrients are good. There are also other supplements that, for instance, people may take depending on what the doctor says. For instance, the expectant mothers may be prescribed what is called folic acid to help in development of the nerves of the baby. And that's also found in good nutritious food. So let's continue eating well, eating healthy. The other thing is exercise. So your exercise program does not stop. For instance, if you are going jogging out with your friends, then what you can do is to maintain physical distance of, let's say, 1 meter. You can be exercising together, but you're maintaining physical distance. So do your regular exercises. My routine is usually jump ups, sit ups, stand ups, and skipping. So for 30 minutes.
So effective. It's such an effective exercise, and you don't need someone else.
Depends on how long you do it.
That's true.
So those are the recommendations. So keep up the exercise. Then now there's also mental health, and that's why we are these social distance does not mean you stop talking to your friends. So you need to keep away from bad news and try to keep yourself occupied with good stuff. Part of good stuff is like some of the things you'll be doing at home, playing games, board games with the children, playing some active games like throwing hoops on and off, some basketball, and keeping positive. And a lot of people are reading books. Now, this is the time to actually get the number of books you've always wanted to read. And there are very many books going around, even online. Even the local cartoon books, comic books that we used to read a long time ago now become a favorite. And reading books generally will help your mental health keep very on top of the game, so to speak. Therefore, in some of the estate groups, you can form estate groups so that you keep motivating each other, sending out good messages around, and also encouraging others. And this would also be a good time to encourage the health workers, the doctors, the nurses, the people on the front line, the people collecting garbage, for instance, the people who are guarding like the facilities and all. It's a good time to encourage them by sending out good words and also be also good to do donations. For instance, currently what we are going to face is a need for what is called personal protective equipment, which are running in low shortage. So we want people to be innovative. We see whether some companies can actually start manufacturing personal protective equipment, because the places we've been importing from are actually now using them themselves, and they are also overwhelmed. So we want people to be innovative. We have many companies that can actually make some income by manufacturing gloves, manufacturing masks, manufacturing other PPEs. And we want people to be innovative such that by the time we come out of this, we will be self-sufficient in a lot of things.
I remember seeing someone with Ankara patterned, masks, which I thought were really cute, but that's a story for another day. In closing, our basic first aid kits in the house. We know that we don't want to overwhelm the health services right now. So there's certain things we can take care of ourselves at home without having to come in to the hospitals. But it also starts with having the right tools. So what would you recommend we stock up on in our first aid kit boxes?
So a lot of small accidents happen at home. Children fall, they get cuts, they can get injuries that majority of them would actually be sorted out at home. So you must manage for cuts. For instance, you have spirit, surgical spirit, or whatever spirit that can be used. And you can also have elastoplast and bandages just to provide pressure for any bleeding spots. So when you get injuries, you would like to maintain hygiene on the place that is cut so that you don't get bacteria entering through the wound. So you clean it and cover it. So get such things. And when it's too hot, then you probably keep some paracetamol in the house, because also when children get temperature that is too high, they may end up having convulsions. And therefore, when you give them a bit of fever reliever, then paracetamol would be good to have in the house. But the big message is keep the people washing their hands with soap and water, preventing them from meeting people who may have contracted coronavirus infection, and just keep healthy, I think.
Keep healthy indeed. These are unprecedented times we find ourselves in. Doctari, forgive me. I'm so thankful that you made the time to chat with me this afternoon. I wish you a wonderful week ahead. I'm sure it's not easy for all of you as medics being in the front line, lakini tunawaombea, and we wish you all the very best. And we say, God bless Kenya, God bless Africa, God bless the world. We shall prevail.
Same you to Sheila. Same you. Keep up the good show. We follow it. Tutaendelea kuifollow.
Yes, forever. So let me sign out now. He's talking about following me on all my social media platforms. There they go. I'm posting information that you need to know on coronavirus, COVID-19, and just positivity. On my spaces, you're not going to find information on the death toll, because the numbers are the numbers. They will speak for themselves. But for inspiration, positivity, he's talked about mental health and staying in the game and being focused and being together here. That's exactly what you'll find on all my social media feeds. And please remember to click subscribe to this channel, hit notifications so you never miss an episode when we upload. Until our next episode of Sheila Lives Out Loud, live out loud in all that you do and stay safe, my people. Bye for now. Kwaheri, Daktari.